So there was an issue on one day last week where there were four members of staff in the TSSU that were off sick. Having four members of sick when it's summer and another one is off on holiday has meant that the elective surgeries on that particular day were cancelled, and there were numerous surgeries on that one day that were cancelled. The issue is that when you have numerous surgeries cancelled in Gibraltar, there is a lot of noise as a result of it. This wasn't as a result of bed shortages. It wasn't as a result of staffing issues. It was as a result of, on one day, there were four people that were off sick, and therefore this unit wasn't able to function as it normally does. It's also important to highlight how the ecosystem of the hospital works, because when you think about surgeries, you think about surgeons, you think about the nurses, but it's also all the staff that's behind it that's running projects, right? So we've got this brand new TSSU that was established a couple of years ago. Huge investment into it. Because of the TSSU and because of other investments that have been made around the theatres, like for example the Omnicell project, which I frequently talk about, which manages the stocks in theatres, we've actually managed to halve the cancellation rates. I think it's something from 1,133 to 519 in 3 years. So there are a lot of things that are going very, very well in order to manage and mitigate and halve the number of cancellations that occur in the hospital. Now, these unfortunately happen in hospitals because of stuff that's beyond our control, as indeed was the case on this one particular day when four members of staff called in sick.
You're suggesting that this has just been one isolated case. Ms. Ladislaus says that this speaks to a wider issue with staffing issues, with bed shortages and so on. Are you saying that's not the case?
I'm saying that there haven't been there haven't been electives cancelled as a result of bed shortages this summer. Um, if there have been very, very few, and I'm talking about one or two as a result of bed shortages. So there isn't this endemic issue of bed shortages as there have been in the past. The bed situation is actively managed on a day-to-day basis in the hospital. Now, that's one issue, and the staff issue is another one. The staffing at the GHA is a very dynamic element. There's a staff of 1,400 people in the GHA, and there's a large turnaround. So are there staff shortages? We don't. It's something that I've answered in Parliament very frequently. The number of clinicians that are employed by the GHA are the number of clinicians that the GHA has requested that the government funds. The vacancy situation is something that we're actively on top of and trying to manage, so that there aren't active vacancies in place. It's something that we look at on a day-to-day basis, but we do not consider that there are staff shortages in the GHA.
Talking about this incident in particular, in which individuals have had their elective surgeries cancelled, what sort of time frame are we looking at to have their surgeries rescheduled? Are they going to be waiting for another year now?
So I'm very, very pleased to be able to say that everyone that had their surgeries cancelled has either already had the procedure done or have had dates in the next month to have the procedure done. I think there's one outstanding person that we had to contact, and that was because they were away on holiday, but absolutely everybody that had their operation cancelled on that day has already either had the procedure done or has a date in the next month to have that procedure done.
Are there any concerns at all that you have specific to this scenario?
To this scenario, well, the TSSU staff. So there's in the TSSU there's 7 within the complement. All the vacancies are filled, so there's no vacancy whatsoever within the TSSU complement. But unfortunately, people do call in sick. People do have annual leave. So it was a conflation of things that happened on that one particular day. However, as I've mentioned, the staff in the hospital, the staff in the TSSU, the staff in theatres are extremely good, and they have already got on top of it and are already calling absolutely everybody to reschedule any surgeries that didn't happen on that day.